Hello, and welcome to our video on an important topic for senior health. As we age, balance issues can become more common, and sometimes it's not just a matter of aging. Certain medications can also contribute to balance problems. In this video, we're going to talk about 10 medications that can cause loss of balance and what you can do to address this issue. It's important to understand that while medications can help with a variety of conditions, some of them come with side effects that can affect your coordination and increase the risk of falls. Always consult with your healthcare provider if you have concerns about any medication you're taking. So, let's dive into the 10 medications that may cause loss of balance and explore how to manage their effects. Medication 1. Antidepressants. Antidepressants are a group of medications that are commonly prescribed to help treat conditions like depression and anxiety. These conditions are increasingly prevalent in older adults, and antidepressants can offer significant relief and improvement in mood. However, while these medications are vital for mental health, they can also have unintended side effects, one of which is affecting your balance and coordination. The two primary classes of antidepressants known to impact balance are SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. These medications work by increasing the levels of serotonin and norepinephrine in the brain, which helps improve mood and emotional well-being. However, the alteration in brain chemistry can also lead to side effects such as dizziness, lightheadedness, and sometimes a feeling of being off balance, particularly when standing up too quickly or moving suddenly. SSRIs like Prozac and Zoloft, and SNRIs like Effexor and Cymbalta can cause a drop in blood pressure when changing positions, also known as orthostatic hypertension. This is why it's common for patients to feel a bit unsteady when they first stand up from a seated or lying position. For older adults, this can be particularly concerning, as it increases the risk of falls, which are a significant cause of injury and hospitalization in seniors. If you are taking antidepressants and notice any issues with your balance, it's crucial to have an open conversation with your healthcare provider. Don't stop taking the medication abruptly, as this can lead to withdrawal symptoms or a return of depression or anxiety. Instead, your doctor may suggest lowering your dose, switching to a medication that has fewer balance-related side effects, or incorporating physical therapy to help strengthen your legs and improve coordination. Additionally, there are specific exercises designed to improve balance, which can be particularly useful in preventing falls. Medication 2. Benzodiazepines. Benzodiazepines are medications that are commonly prescribed to manage anxiety, insomnia, and certain seizure disorders. Medications like Valium, Xanax, Ativan, and Klonopin fall into this category. These drugs work by calming the brain and central nervous system, making them very effective for short-term relief of anxiety and insomnia. However, these benefits come with a downside. Benzodiazepines can significantly affect your balance and motor skills. When taking benzodiazepines, one of the most common side effects is drowsiness, which can lead to unsteady walking and a lack of coordination. Since these medications work by depressing the nervous system, they can slow down reactions and cause dizziness. This becomes especially problematic in older adults who may already have decreased balance due to age-related changes in their body. The risk of falls becomes higher because the sedating effects can make you less aware of your surroundings, and the dizziness can make it harder to stabilize yourself. If you or a loved one are taking benzodiazepines and experiencing loss of balance, it's important to address the situation promptly with your healthcare provider. Your doctor may recommend a reduction in dosage, or in some cases, they may suggest a safer, non-sedating medication. In certain cases, switching to alternative treatments like cognitive behavioral therapy for anxiety or other sleep aids may help you manage symptoms without compromising your balance. Additionally, maintaining a steady walking pace, using mobility aids like walkers or canes, and practicing exercises to strengthen the muscles involved in balance can help manage the side effects. Medication 3. Antihypertensives. Antihypertensives are medications that are used to manage high blood pressure, a condition that is very common in older adults. High blood pressure, if not controlled, can lead to serious conditions like heart disease, stroke, and kidney failure. However, some antihypertensive medications can cause side effects that impact your balance, particularly when you change positions quickly. Medications like beta blockers, ACE inhibitors and diuretics are all commonly prescribed to lower blood pressure. While they are effective at managing hypertension, they can cause dizziness or lightheadedness, especially when you stand up too quickly. This occurs because these medications can cause a drop in blood pressure, known as orthostatic hypertension. The sudden drop can make you feel unsteady and can increase the risk of falling. Diuretics in particular can also lead to dehydration, which compounds the dizziness and can further affect your balance. To help mitigate these effects, it's essential to rise slowly from sitting or lying down. Give yourself a moment to adjust before standing up fully. Staying hydrated is also crucial, especially when taking diuretics, as dehydration can exacerbate dizziness. If you experience significant balance problems while on antihypertensive medications, it's important to discuss this with your doctor. They may adjust your medication, recommend lifestyle changes like a low-sodium diet, or offer alternative treatments to help manage your blood pressure while reducing balance-related side effects. Medication 4. Antihistamines. Antihistamines are commonly used to treat allergic reactions, hay fever, and cold symptoms. They work by blocking histamine, a substance in the body that causes symptoms like sneezing, itching, and congestion. However, older generation antihistamines, such as diphenhydramine, found in Benadryl, are known to cause drowsiness and can significantly affect balance and coordination. These medications can cause sedation and dizziness, particularly in older adults. While they're effective at treating allergy symptoms, they can leave you feeling lightheaded or unsteady on your feet, which increases the risk of falls. The sedating effects of these medications can impair your motor skills, making it more challenging to maintain balance while walking or standing. If you're using an antihistamine and notice balance problems, it's a good idea to switch to a non-sedating antihistamine like loratadine, Claritin, or cetirizine, Zyrtec. These newer antihistamines are less likely to cause drowsiness or impair balance. Additionally, it's important to avoid alcohol while taking antihistamines, as alcohol can enhance the sedative effects and further increase the risk of losing balance. If you continue to have balance issues despite switching medications, consult with your healthcare provider for further recommendations. Medication 5. Muscle relaxants. Muscle relaxants are often prescribed to relieve muscle spasms, pain, and tension, and they can provide significant relief for people with conditions like back pain or fibromyalgia. Medications such as Flexeril, cyclobenzaprine, Soma, carisoprodol, and Skilaxin metaxalone are commonly used for this purpose. However, these medications also come with side effects that can impact your balance. Muscle relaxants work by calming the muscles and central nervous system, which can cause drowsiness, dizziness, and a general sense of unsteadiness. This can make it difficult to walk or stand without feeling off balance. The sedative effects of muscle relaxants can be even more pronounced in older adults who may already have changes in their balance due to aging. If you're taking muscle relaxants and experiencing balance problems, it's important to speak with your doctor. They may suggest adjusting the dosage, changing medications, or exploring non-pharmaceutical options such as physical therapy to help improve your balance. Strengthening exercises and balance training can be particularly beneficial as they help improve coordination and prevent falls. In some cases, your doctor may recommend alternative treatments like stretching or hot-cold therapy to help alleviate muscle tension without compromising your balance. Medication 6. Anti-seizure medications. Anti-seizure medications are crucial for individuals living with epilepsy or other seizure disorders. These medications, such as phenytoin, dilantin, and carbamazepine, Tegretol, help control and prevent seizures, which can be life-threatening. However, as effective as these medications are for managing seizures, they come with potential side effects that can affect your balance and coordination. One of the most common side effects of anti-seizure medications is dizziness. This can occur due to their sedative effects, which slow down the nervous system and impair motor coordination. The dizziness and drowsiness caused by these medications can significantly affect your ability to stay steady on your feet, making it more difficult to walk or even stand for extended periods. Coordination issues are also a concern with some anti-seizure drugs. If you've been prescribed medications like phenytoin or carbamazepine, you may experience difficulty performing tasks that require precise movements, such as writing or tying your shoes. This can lead to unintentional falls or accidents, particularly in older adults who may already be experiencing age-related balance issues. If you're taking anti-seizure medications and begin to experience problems with your balance, it's important to discuss this with your healthcare provider. Don't stop taking the medication on your own, as doing so could trigger seizures. Instead, your doctor may recommend adjusting your dosage, switching to a different medication, or incorporating physical therapy to help improve your coordination and balance. Physical therapy can be particularly helpful for strengthening the muscles involved in maintaining balance and reducing the risk of falls. Medication 7. Diuretics. Diuretics, also known as water pills, are commonly prescribed to treat high blood pressure, heart failure, kidney disease, and conditions that cause swelling. Diuretics work by helping the body get rid of excess sodium and water through urine, which can alleviate symptoms of fluid retention and lower blood pressure. However, while they are effective in managing these conditions, diuretics can also cause side effects that affect your balance. One of the most significant side effects of diuretics is dehydration. Since diuretics cause the body to lose fluid, they can lead to a drop in your hydration levels, resulting in dizziness, lightheadedness, and a lack of stability when standing or walking. Dehydration can also cause a reduction in blood volume, which in turn can lead to a drop in blood pressure, contributing to the feeling of being unsteady on your feet. If you're taking diuretics, it's essential to stay well hydrated by drinking plenty of water throughout the day. Avoid rapid changes in posture, such as standing up quickly from a seated or lying position, as this can increase the risk of dizziness and falls. If you continue to experience balance issues, your doctor may consider adjusting your diuretic dosage, changing to a different type of medication, or adding supplements like potassium or magnesium to help support electrolyte balance and reduce side effects. Medication 8. Statins. Statins are medications commonly prescribed to lower cholesterol levels and reduce the risk of heart disease. They work by inhibiting an enzyme in the liver that produces cholesterol, helping to lower levels of LDL cholesterol, often referred to as bad cholesterol. Statins are vital for heart health, but like all medications, they can come with side effects that affect your balance. One of the more concerning side effects of statins, particularly in older adults, is muscle weakness. This can make it difficult to maintain balance and stability, especially when performing physical activities that require strength or coordination, like walking or climbing stairs. Some individuals may also experience dizziness or lightheadedness while on statins, particularly if they are also taking other medications that affect balance or blood pressure. If you're taking a statin and notice any balance issues, it's important to talk to your healthcare provider. Statins are essential for heart health, so your doctor may adjust your dosage, suggest an alternative statin, or recommend additional therapies to improve your muscle strength and balance. For some people, incorporating physical therapy or exercises that focus on strengthening the legs and core can significantly improve balance and reduce the risk of falls. Additionally, your healthcare provider may explore adding supplements like CoQ10, which may help reduce some of the muscle-related side effects of statins. Medication 9. Opioids. Opioids are powerful pain-relieving medications that are often prescribed for severe pain, such as after surgery, or for chronic conditions like cancer or arthritis. Medications like morphine, oxycodone, hydrocodone, and fentanyl are commonly used to manage acute and chronic pain. While opioids are effective in alleviating pain, they come with many side effects, one of which is impaired coordination and balance. Opioids work by binding to receptors in the brain and spinal cord to block pain signals, but they also affect the nervous system, leading to drowsiness, confusion, and dizziness. This can significantly impair your ability to maintain balance, especially when standing or walking. Long-term opioid use can lead to tolerance, meaning higher doses may be required to achieve the same level of pain relief, which increases the risk of side effects, including balance problems and falls. In older adults, the risks of using opioids are heightened. Since older adults are more likely to experience age-related changes in muscle strength, coordination, and balance, the sedating and dizzying effects of opioids can lead to serious falls and injuries. If you're taking opioids and noticing any balance issues, it's crucial to consult with your doctor. They may suggest alternative pain management strategies, such as non-opioid pain relievers, physical therapy, acupuncture, or other non-invasive treatments that can help manage pain without compromising balance. Your doctor may also recommend a gradual tapering off of opioids to minimize withdrawal symptoms and prevent further balance issues. Medication 10, Parkinson's disease medications. Parkinson's disease is a progressive neurological disorder that affects movement, causing symptoms like tremors, stiffness, and difficulty with balance. The primary treatment for Parkinson's disease includes medications like levodopa, which helps replenish dopamine in the brain and alleviate symptoms. While these medications are crucial for managing the disease, they can sometimes cause side effects that impact balance. Levodopa and other Parkinson's disease medications can cause dizziness and lightheadedness, particularly when standing up quickly, a condition known as orthostatic hypotension. These medications may also impair coordination, making it harder to walk steadily. As Parkinson's disease progresses, balance issues tend to become more pronounced, and the effects of the medication can contribute to this decline. If you're taking medications for Parkinson's disease and experience balance problems, it's important to speak with your healthcare provider. Your doctor may adjust your medication dosage, switch to a different medication, or refer you to a physical therapist who can provide exercises to help improve your balance and mobility. Physical therapy can play a significant role in helping people with Parkinson's disease maintain their independence and reduce the risk of falls. In some cases, assistive devices like walkers or canes may be recommended to further help with stability and support. In conclusion, while many medications play a crucial role in managing health conditions, it's important to be aware of the potential side effects, especially when it comes to balance issues. If you or a loved one are experiencing loss of balance or dizziness while taking any of these medications, don't hesitate to reach out to your healthcare provider. They can help you find the best solution to manage your condition while reducing the risk of falls. Thank you for watching, and remember to always prioritize your health and safety. Stay informed, stay active, and stay balanced.